Other myth is that the recovery period, people think that, and that's because of the influence of social media, I believe. They see the befores and afters and they, wow, that's tomorrow. So the surgery was today and the picture is tomorrow. No, it's not true. Often the pictures, the good ones are, I think, a year
6
apart,
months, a year.
minimum a year.
Yeah.
And this is where we start and see the results after the surgery. So these are some of the myths that are
instant gratification. I think that people go, well, I want this, and they have to be a little bit more patient when it comes to it. Because I guess when it comes to face or body, it takes time to settle in. Welcome to the show, Dr. Tarek. It's great to have you here. We've spoken so many times, and I've been to the clinic. Why don't you tell everyone a little bit about who you are and what you do?
So my name is Tarek. I'm a plastic and reconstructive surgeon. I've been in Dubai now for almost 10 years. And I've been doing this for nearly 15 years.
Tell me, everyone, a little bit more. So I think when you talk about plastic surgery, I think certain things come to people's minds. So what kind of, I mean, your facial rejuvenation and is body contouring. Did I say that right?
You did say that right, yes. And thank you for marking the word. It's plastic and reconstructive surgery. This is the name of the full name of the specialty.
Plastic and reconstructive surgery.
Correct. And one of the things that we're gonna speak in depth, face and body is something that we do. So when we say body, it's body contouring. It means reshaping the body, taking it from shape A to shape B to a better shape, of course. And also the face. So we do faces and we do bodies.
So when you say rejuvenation, we're talking like facelifts.
When I say rejuvenation, I mean making the faces better, either with non-invasive or invasive procedures. The invasive procedures would be the facelifts, the transfer of fat, the periorbital rejuvenation, we call it, the upper and lower blepharoplasties, rhinoplasties, lip lifts, ears, and basically the face. So that's invasive. The non-invasive is the things that we do at office. It's Botox, filler, and sometimes some plastic surgeons decide and do threads.
You're not a fan of that, so we talked about this,
we did. I'm a fan of a facelift. It took me a long journey to master and learn the facelift surgery. So it's for me, a thread lift is something that I'm trying to avoid because I lean towards cutting people. So
how did you get into plastic and reconstructive? I mean, is that something you always wanted to do, or what's the journey of becoming?
It was not actually. I started my medical school. I was 18 years old. It took me 8 years to finish my medical schools, after which at the end I knew a friend. I mean, he's still my friend. His dad was working here in this country, in Abu Dhabi, and since then it was finish your medical school and come to Abu Dhabi, finish your medical school. And I didn't have a clue I will come to Dubai. So it was always in my mind that it's the Emirates, United Arab Emirates. And then at the end of my medical school, I had the opportunity to go to a surgery department and to serve my military civil service in the Department of Surgery. And this is where I liked and I loved surgery.
So what was it that you liked so much?
One thing led to another, and then here I am. I became a plastic surgeon. Why plastic surgery exactly? Because plastic and reconstructive surgery, it's probably the oldest surgical specialty on earth, and it's a huge gray zone. We interact with all other surgeons. So when we have a big wound and we need to close and cover that wound, there's a surgeon who needs to do that. That's a plastic surgeon. And plastic surgery actually dated 4,000 years ago. You can see it in the Indian manuscripts, and also in Egypt manuscripts. People reconstructed noses. Burn patient always exists, so they had to deal with burn wounds. So this is how the plastic surgery was created.
So you have to do 8 years training in medical school and then specialize. And
then 5 years or 6 years, depends on the country of specialty. That's correct.
So it's a long process.
That's a significant amount. That's around maybe 15 years of just studying to become one.
Wow. You're trained as a plastic surgeon and reconstructive, and then you go out on your first patient?
Yeah, it's not precisely like that. And then on top of that comes the aesthetic surgery. Aesthetic surgery is one part of plastic and reconstructive surgery, and it is considered to be the crown of our specialty. It's a completely, if I can name it, a different animal, because now you're in private, and now you're seeing private people, private patients who probably are not covered by insurance. They pay by cash, and they want results. They demand results, and which will be the topic of our podcast today. Then you have to learn it by traveling all around the world, meeting people, masters in their aesthetic surgeries, people who master their aesthetic surgeries, and learn from them. And you go east and west, north and south, and you practice. And we have workshops as well that we attend almost yearly.
Yeah.
And this is how we learn. We work with other experienced plastic surgeons, and this is how also we learn. So it's a long journey.
You came out to Abu Dhabi.
My intention was to come to the Emirates, to here, and I ended up in Dubai, which was a great thing to experience. Yeah.
What was the start of that journey?
So I started private practice around 2 years, and then shortly I joined a government hospital here in Dubai, Rashid Hospital, 𝗕𝗿 Dubai Health Authority. I spent 2.5 years almost, and then decided to go back again to become a private plastic surgeon. That was 2016, 15, 16. Yeah, and since then I'm in private.
What made you go back to private? Was it the type of clients, or?
It's a decision that I wanted to make sooner or later. So I'd rather make it sooner than later. And I had very much good advices from good colleagues that said, like, if you want to do it once in your life, it's better to do it early rather than late.
And get that experience.
And experience, and so that's it. It's nothing that was pre-planned. It was just life.
Yeah. So what are some of the myths in your industry? Because I think, we touched on that slightly when I started about plastic surgery, and people have this impression of plastic surgery, but it's come on so much, in the past 10 years, and it's about being subtle, and, it's not about, it's noticeable. I think that's one of the things that...
myths a lot, and every corner of, let's call it now cosmetic or aesthetic surgery, because it's not the wound and the cancer stuff and the limb reconstruction, enhanced surgery and pediatric plastic. It's now the private practice. It's aesthetic surgery, cosmetic surgery. There's a lot of myth. Let's start from the non-invasive ones like Botox and fillers. So people think that if they do Botox and fillers many years, their faces will freeze and then will never go back to the original face. It's not true. You stop doing it, you're going to just age, and that's it. Another myth around Botox and filler is that, and I hear that every day, almost every day, doctor, can you make us look younger? The answer is no, it's a myth. I can't. But I can delay the aging of the face. I discuss it almost every day.
But that's what people come and say. Make me look
so
younger.
instead of somebody looks 60 at the age of 60, that somebody will look 50 at the age of 60 if they do it now. Other myths, and important myth, is that aesthetic surgery is only for rich people. It's not. It's for everyone. Everyone can afford it, by the way. Another myth, a beautiful myth, is that there are no scars. There are big scars, and sometimes ugly ones. But it's not the end of the world.
But that's how you manage it as well. Is there a treatment that you can put on? But
exactly. It's not and it's a. We are the only maybe plastic surgery or aesthetic surgery specialty doctors that we have to deal with the patient many times before and during the surgery, and that person becomes a friend for the rest of the life. So something happens after 25 years, they will pick up the phone and, doc, what's this? It's 25 years ago, but we need to know. So other myth is that the recovery period, people think that, and that's because of the influence of social media, I believe. They see the befores and afters, and they, wow, that's tomorrow. So the surgery was today and the picture is tomorrow. No, it's not true. Often the pictures, the good ones are, I think, a year
6
apart,
months, a year.
Minimum a year. And this is where we start and see the results after the surgery. So these are some of the myths that are
instant gratification. I think that people go, well, I want this, and they have to be a little bit more patient when it comes to it. Because I guess when it comes to face or body, it takes time to settle
it takes
in.
A lot of time. 6 months is the minimum amount of time that it needs to.
What was your first reconstructive surgery?
During my specialty and training, we used to do a lot of breast reconstruction after breast cancer removal. And when these women are cured, completely cured, and then they need a new shape of the breast. So this is when we take a piece of a skin and muscle and put it back with the vascular pedicle to its another place, so it will mimic and look like a breast. Yeah. We sometimes take the abdominal muscle with the abdominal skin. We call it the tram flap, or the latissimus dorsi. You said you will have a fitness coach. He will maybe mention the latissimus machine or the lat machine.
Yeah, the lat machine. Yes,
this is the same muscle that we transpose to the breast, and then we reconstruct the breast. So we have two options. We have many options. These are the most common two.
And that was the one that that's what you started.
And this is the reconstruction that we started. As part of my training, I was in the burn department for 3 years. Yeah, long 3 years. So you're dealing with burn patients and how to reconstruct the wounds. Yeah.
Working with burns or scar tissue. That's tough compared to.
That's correct, and this is how the training is done. You start with tough things, and then in the future you could decide to stay there, or you can go and do aesthetics like I decided 10 years ago. Yeah.
What was it like when you had that sort of first patient that came in that had significant burns? Did you think, wow, how can we deal with this, or was it? I mean, what's that like? Because I can't imagine.
I remember it as it was yesterday, actually. It was after midnight. And they just come. You never know when an accident can happen. And then it was after midnight. The key is that the nurses that works with you are experienced nurses, and they work in a burn department. So, and you're a young doctor, a trainee, and they're like, doctor, calm down. Everything's okay. He's burned. Okay, it's just let's A, B, C, D, 10 things that we have to do. And then we do it, and then he's admitted, and that person is alive, he's burned, and then the journey of the healing starts. Yeah, so it's an environment that we worked in, and of course, many experienced people work together, so the less experienced learn from the more experienced. This is how it was. Yeah, it's a shock, of course. Like,
I can imagine. Where was that?
It was in Belgrade, in Serbia. Yeah.
And do you remember the person?
I don't remember the person.
The environment.
Yeah, but the environment was overwhelming. Yeah.
What have been some of your challenges throughout the past 15, 20 years through building your experience, maybe the marketing people? What have been some of the challenges?
So the greatest challenge for private practice is to establish your private practice, your name, your brand. And there's the most difficult thing, in my opinion, is the doctor-patient relationship. And there's how to manage the expectation of patients. We are not the same. We don't think the same. For me, this is white. For them, might be off-white, and there's slight differences. And then you have to try and understand and to manage the expectation once you think you understand the expectation. That's one challenge. Yeah, but I think even more a greater challenge is the trust that you need to learn to build with your clientele.
How do you do that then? How do you build trust with your client?
I think it's a skill. It's nothing that you are born with. I think you just need to sit there, have people and speak, and you have to learn to listen. I think listening is the key. Yeah.
What kind of questions should someone ask? So if they were looking to have some kind of plastic surgery and they're looking for a surgeon, what questions would you want someone to ask you? So what should they be looking for?
Well, you mean a patient? If the patient comes in?
So if someone's watching this and they're like, I want to have some surgery.
Yeah.
What questions should I be asking the plastic surgeon?
Every plastic surgery or cosmetic surgery starts with the first consultation. This is where we meet, and this is when I start to understand the needs of that person. So that person, if a woman wants breast enlargements, it's easy. I want bigger breasts. All right, let's now talk about it. What do you mean by bigger breasts? So for somebody, this much is big. For other people, that much is big. So we have to, and then we have also the physical examination. Then after the talk, that all right. So your figure, we could not accommodate that much big implant in each breast because of the limitation of the tissue. And then if that somebody understands, then it's fine. So we are on the same page. If that somebody insists, that's a red flag.
And what happens then in that situation? Would you not work with a patient?
And if we meet, then I work with the patient. But if we don't meet, if we don't agree together, I say, I'm sorry, I'm not your surgeon. I don't think I can deliver.
So you'll be honest with them.
Of course, I don't want to run into troubles.
Yeah.
Neither I don't want to jeopardize patient safety. Patient safety is number one. So that's,
They have the consultation. What other questions should someone be asking or looking for?
Let's give an example for a body contouring liposuction, for example. That's in almost every day's work. The first question is the recovery. How long do I need to recover? And that's around maybe a week to 10 days. It depends on also the amount of the fat needs to be removed. And then how will the recovery be? Is it a rough recovery? Is it going to be a lighter recovery? And what are the steps needed after the surgery? These are the usual questions that I get from the patients. Is it going to be painful? Is it not going to be painful? What are the medication?
Pain, because what's painful to someone is one thing.
Usually I say we have pain management medications that everybody gets. It is annoying. And it's not going to be painful. And it's true, it's not going to be painful if that somebody takes the medications on time. Because we have a set of medications. And sometimes some people, they say, I didn't have pain today, so I skipped my medications. And then tomorrow I have pain. So don't skip medications. So yeah, these are the usual questions. Pain, recovery periods. There's a myth there. How many kilograms I will lose. So liposuction is not a weight-reducing surgery. It's a reshaping surgery. So we just give a shape. Yeah,
that's a myth.
That's one of the myth that is sorry about that. The myth about liposuction. Yeah.
What would be the steps after? So we've got liposuction. What else would they need to consider if they were going to do surgery?
So after the surgery, there's the follow-ups. Yeah, and there's the visits to the clinic where I am. There's something that we do in Body Smart Polyclinic is after the tummy tuck or after the liposuction, after body contouring surgeries and other kind of surgeries, we offer a negative pressure massage, LPG massage. This is to enhance the quality of, to reduce the recovery period and to enhance the vasculature of the skin, and it's a lymphatic drainage as well.
I love LPG.
It will shorten very much the recovery, and it will enhance actually my results by taking away all the unwanted effects from the surgery. Yes, indeed.
What's your favorite kind of surgery to do?
A facelift.
Is it? Tell me, why is a facelift?
It took me a long time to master it, or at least I think I mastered it. I went all the way from the US to Australia, following many people that are masters of their facelift surgeries, just to learn from them. So I invested everything I have, and I think if I invested in percentage-wise, maybe 80% of everything I invested in facelift. Yeah.
And is it because of the results that you see that they're so different, or is it the attention to detail?
It's because it's very challenging one. The surgery is very challenging. On the scale of difficulties, I think a facelift is probably 8 or 9.
And is that because of scarring? Is it because of tissue? What makes it so complex?
Because the aging of the face is multifactorial, and it's not only the technical skills that the surgeon has to have in order to achieve the result, is knowing what to do is the most difficult part. As I said, face is also, it's like onion, it has layers, so we need exactly to know what to do to each of these layers. Which one to pull more, which one to pull less, where to cut and how to cut. So it's not only mechanical work and then, cut and stitch together. No, you have to be precise. You have to know what to do.
And do you only know that when you go into the surgery, so obviously you see someone beforehand and you look at it?
That's beforehand, yeah.
Yeah, but when you're in the surgery, do you try?
So prior to the surgery, we have the consultations many times, and then we exactly know what layer is loose the most and what to do.
So you know that before you go in.
And then we just confirm it at the surgery at the table, and then we do that at the table, and that's it. And once the surgery is ongoing, when we start working, the swelling overcomes everything. So there's no way that we can know that we did good because it's now swollen.
And is that the same?
But we know that we had to do 1, 2, 3, 4, 5, and we did that, and we assume it's going to be all right. And it's going to be all right, yeah.
Is that another one that takes 6 months till you actually see the final?
You can see the actual results after a week or 2, but the final results are after 6 months. always.
So when should someone go for a facelift? Like, is it like wait till you're 60 or 70 or?
That was before. People waited 50 plus to do their facelifts. Nowadays, I think that even women and men, which is another myth, that men don't do plastic surgery. No. I think over 40-ish, they start doing.
Yeah. When would you say would be ideal?
Why don't you enjoy your face? I mean, it's young. I'm eligible for a facelift, by the way. If you just look at me, if you have stretched this, yeah, why not? So I can enjoy my face young for the next 15 years.
So what happens? So he gets it done.
And I'm planning one, by the way.
Are you?
Yeah, of course.
So then you will do all the research to find, because you can't obviously do your own. Who would do yours?
Well, many. I have many on my list who can do my facelifts, of course. Yeah.
Really?
Yeah.
So
one of them is retired Brian Mendelsohn from Melbourne, Australia. I don't think I will be lucky enough to have him operate my face. Yeah, because I think he stops doing surgery. Yeah. I don't think I know. Yeah.
But is that the whole thing that we look in the mirror? Well, I think especially with TV, like I notice it as well, and I go, well, if I just did that, then things would look a lot better, and it just drops down. But that's just age, I guess, and tighten it up here.
This is where it starts, just here. Yeah, that's another myth. It's like the short scar versus the long scar. It's just, many people will say surgeons like, it's a very short scars, blah, 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 plastic surgery, facelift. It's not. So for only this, we have to do a big scar.
Yeah. As in like one down the front?
As in front of the ear and probably a little bit behind the ear. Especially when we want to tackle the neck as well, because, when you do the face, I mean, it's like the neck is here, do the neck as well. You're a plastic
so all of that comes
up. So it's
up.
everything, yeah. And aging of the face is around here, yeah.
And then so you do the lift, and then you also do a fat loss transfer, is that right?
And then because we lose volume, as I said, it's multifactorial. So other thing happens is that the bone, the maxillary bone, in Homo sapienses, it shrinks. So when something shrinks, we lose the volume. We need to replace the volume loss. This is when we can do many other options. Fat is one and the most used option. So we take fat from places, we refine the fat, process it, and inject it in the places that we need to. We can do implants as well. We have cheek implants, silicone implants. Yeah, I don't do those. I do fat.
Yeah.
Yeah.
When you do a facelift, you're just doing this, or you're
almost always we do the fat grafting.
Yeah.
Almost always we do the periorbital rejuvenation, because eyes are windows to the soul. So if you're doing a facelift and you have a little bit extra skin on your upper lid, so do that as well. And then when you pull everything up, you have buckling of the lower eyelid.
Yeah.
So let's do that as well. So it's
so it's just not a case of cutting in here and pulling it up. There's many other things to think about.
It's done on the initial consultation. We show the patient, I'll just pull your skin like this, and then you can see there's a buckling here, there's excess skin, so let's remove that as well. And hey, we're doing also your lower eyelid and facelift. Let's do the upper face, upper eyelid as well. And then your brow are a little bit down, so why don't you think we're doing everything together? So it's a brow lift, and it's a full work.
So I was quite curious there, because you mentioned after 15 years, do you need to get it redone, or what happens? You have it so let's just say you have it when you're 50, and then you have to go again when you're 65 or 70, or how does it work?
Definitely yes. For two reasons. First of all, we live on Earth. Gravity brings everything down, and it will remain that way, I think. And the second thing is that we use our muscles, and we will keep on using them. These are the muscles of mimic muscles. So as long as you use your muscle, they will stretch and relax and stretch and relax. And then when they do so, they stretch with themselves some ligaments that they sag. And when they sag, this is when it needs to be redone again. 10, 15 years, sometimes 20.
Is it as invasive, or is it more just kind of touch-ups, or?
It's not. It's from the beginning. It's everything. Yeah. But let's say if somebody has his facelift and everything done by the age of 41, 2, 3, 4, 5, that somebody will have it redone at the age of 70. Many decide not to do anything at the age of 70. They just enjoy their lives.
Yeah. It's like, okay, we're here.
But I know examples of women or men who redid it actually at the age of 65, 70. Yeah.
And have you done the same person after 15?
Never.
Not
I
yet?
haven't. I've never done the same.
I'd be curious to go in and see what your work was like, and then you know where you are.
But I've
now.
done people who did facelifts with other surgeons over
Okay.
the past 2-3 years, and they were not satisfied, and then a touch-up needs to be done. It's a very difficult surgery. So the secondary and tertiary facelifts are difficult because of the scarring that forms, and it bleeds like hell. And then the 3 hours surgery, it's 6 hours now because it needs to be done meticulously and carefully, so it takes longer time.
Yeah. So
Yeah.
normally it's 3 hour facelift.
In my hand, it's around 4 hours. Yes,
Okay.
I'm a slow surgeon. I take my time. I
Attention to
enjoy
detail.
working.
Yeah. And then, but then
I check. I double check. Sometimes I triple check, and then we close.
Amazing. So how have you been building your brand and you know your name? What have been some of the good strategies that have worked with you? I imagine word of mouth when it comes to
Word of mouth is the best, of
Yeah.
course. One of the patient trust is the second one. So you build trust. The patient, you also learn how to manage the expectations. Often you're not successful, but that are the things that you need to do in order to build a strong brand.
Yeah. What are some of the things? So you said that you go and learn from other surgeons, you travel a lot. Like, what's next for you in terms of what you're doing? Is it more of the learning from others, or is it a particular surgery that we don't have here yet, or technique?
Well, Dubai is a metropolitan, so we have everything here, by the way, and it's probably top 5 plastic aesthetic surgery countries in the world. Being the US, probably the first, and then the Latin America and South Korea, and then us here. Yeah. In my opinion, I think we're stronger than Europe in aesthetic surgery, that we have a lot of things happening almost every day. What is the next thing that I think that if somebody needs to learn more, that somebody needs to do that particular surgery over and over again. And if that surgeon is lucky and have somebody senior to him to work with, that would be it. Yeah. Workshops as well. So we often practice a cadaver workshop, we call it.
Okay. What, on real people?
On cadavers.
Oh,
So these are the dead bodies that are. These are science institutes that I just came back from Amsterdam last year, from Ghent this year, in Brussels. Also, I did some cadaver workshop for 3 days. We did varieties of techniques on facelifts. Yeah.
Just trying to even get my head around that. So what's it like versus someone who's dead and alive? Like the tissue must be different.
The tissue it's a fresh cadaver. So that person passed away like a day prior to the workshop. So
okay,
it's
so
still considered to be fresh. It's a little bit more difficult because still the tissues are not alive. But we discuss the techniques, and we do. So it's usually 2 surgeons on one cadaver, and then we have a full room of, it's an institute of 38 surgeons. So each surgeon one dead body, and then we do it in steps. It's usually very tiresome. It's 3 days, 10 hours per day, and
Wow.
and let's do this now, 1, 2, 3, and then we do it, and then the lead surgeon explains what needs to be done. Yeah, we had big names. It's ISEPS, actually, International Plastic Surgery Society. They did organize it now in Brussels.
I never would have come. It makes sense, though.
Yeah, this is how we learn. Yeah. This is how we learn. Yeah.
So I have a couple of questions for you. I like
All right.
a little bit of a quick fire. These are questions that are storytelling. I do not know, so you can pick the card, and I don't know what's coming up. So
they're not difficult. I
no,
believe.
they're story conversations.
Can
So go for it. 𝗕𝗏. You can pick one. And I was gifted this at Christmas time, and it just evokes really nice conversations. So what's your question?
Oh.
Is that hard?
No, is this my wife? Ask you to ask me. I spent too much money on.
I love it. What do you spend too much money on?
Actually, I think I don't spend too much money on. I think on sport. I have my monthly fees for my CrossFit box, and I love to buy these kind of gadgets. And
what was the last gadget you bought? What's the last gadget?
I will tell you if you promise not to laugh.
Okay.
A Dutch oven.
A Dutch oven?
So that's a small, a bowl that you can bake your bread in it.
Oh, okay.
Yeah, so yeah.
So how much
and I've
bread?
used it only once. It's 250 dirham and used only once.
And are you going to use it again, or is that
That's a good question. Yes.
Okay. Well, I look forward to trying some
on
of your
gadgets.
things.
So my answer is on gadgets. I love to buy gadgets.
Oh,
Yeah.
what's the best gadget you've ever bought?
The best one I've ever get was a laser leveler.
A laser leveler for like doing shelves and
yeah. So when we do preoperative markings on patients, so because by the way, we are probably the only surgeons who have to do one side, and then we have to do another side. So we have both sides to be equal.
Yeah.
And when we mark our patients or the preoperative markings, we need to be as equal as we can. And then I use the leveler of the architect. So there's a laser leveler, so I see that my both lines are equal. Yeah.
And is that not something that many plastic or
No, I think it's nowadays everyone
More
uses
aware.
that. Yeah, but that was the last gadget I have.
I
Yeah.
love it. Okay, one more. This is good fun.
I hope there's a question about my science project, like this one.